Welcome, 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 and thank you for spending some of your time with us. My name is Tina Rosenquist, and this is Knowledge for Wellness. And this show is to better inform you, because the more information you have, the better decisions you can make. And knowledge is power. And today's topic is on accelerated recovery performance. And bringing us this great information is Denis Thompson. He is the developer of the ARP Wave. Welcome, Denis.
Thank you, Tina.
So glad that you could join Knowledge for Wellness again.
Well, it's always a pleasure.
Thank you. And you have been on the show about 5 times, and we have reviewed quite a lot and watched the development of a retired firefighter done Skype, and we've actually brought together a lot of series. But I'm not sure all of my viewers had the great opportunity of being introduced to you, so I'd really like for you to take a moment, talk about yourself and actual ARP Wave.
Well, for the listeners who haven't been with us, ARP Wave is a system by which we can speed up the recovery of all types of injury and surgery and prevent the majority of most orthopedic surgeries. And we treat probably 200 to 300 patients every month, prevent things like having a knee replacement, spinal fusion, hip replacement, those type of issues.
Okay, and so this is on the lines of the alternative of actually surgery, but also if they do have surgery, you also help in the recovery process as well.
Oh yes, yeah, we speed up that whole process. If your doctor tells you it's going to be 6 to 9 months with us in our system, you're probably looking at about 5.5 to 6 weeks.
Okay, so when you're talking about treating everyone, can you treat everyone? I know you can't treat people that actually have pacemakers that are pregnant, but also
defibrillators. We can't treat those either. Pretty much anyone. And a standard rule of thumb is that if you have pain, we can help you, because pain is nothing more than a signal that the muscle is protecting you. And so we talk about so many people that have joint problems. And we talked about this in earlier shows. There's really no such thing as a joint problem. All it is the muscle's not supporting the joint. So if you work on the joint, you're not going to be all that successful. If you work on the muscle that's supposed to be supporting it, you're going to be very successful. And that's really what we do.
Yeah. Now, how long do people see results?
Oh, they'll see the results in the very first treatment.
Okay.
As an example, let's say that you have been told that you're bone on bone. You cannot get out of a chair without pain of 8 or 9. When we give you the first treatment, and because what we say sounds too good to be true, we give you the first treatment so we can demonstrate to you and anybody else watching that we can help you.
Okay.
So all of a sudden you get up out of a chair and you have no pain, it's pretty evident that we can help you.
Yes. Yeah.
I mean, it's instantaneous.
Yeah, that's so great. So how long would the session last then with you?
Each one of the sessions will be about 15 to 20 minutes. The initial evaluation process where we determine phase 1, are they in neurological balance? And then we do phase 2, which is the therapy itself, the first treatment. That's going to take about 40 minutes. So the very first one's 40 minutes. Everything after that's about 20.
Okay, so in a treatment, what should I expect then when I'm talking with you and I have, let's say, a knee issue or a hip issue? What would I expect?
You'll see an immediate change in your symptoms, instantaneous. And people say, well, how's that possible? You know, we use an analogy that if you go to a physical therapist and your arm is in this position right here, the physical therapist's job is to get your arm to go straight.
Right.
Okay? And they have probably 16 to 18 weeks needed to get that down, because what they're doing is they're fighting the signal that's causing the arm to be in this position. What we do in a 16th of a second is change the signal so the arm goes down.
Oh.
So we're just changing the signal rather than fighting the signal.
Okay.
Big, big difference. So everyone who's treated by us for the very first treatment sees an immediate change in their symptoms. If they can't raise their arm, they raise their arm. If they can't sit without pain, they sit without pain. If they can't move or twist without pain, they move or twist without pain. Immediately, because we've changed the signal.
Okay. And you talked about the signal as taking the brain out of the equation.
Correct.
Yes.
Yeah. If you've been told you can't move your arm, you can't move your arm. And your brain is constantly telling you can't move your arm because we're hardwired that when we're hurt, the brain kicks in and it sends a signal to our muscles to protect us. We call it splinting a joint. So therefore you can't move. Well, obviously you can't heal if you don't move.
Right.
So what we do is change the signal so you can move.
Okay. Now, by doing this, it kind of throws out a little bit of an alarm, but are there any side effects to it?
No side effects whatsoever. This is a technology that's been used for, well in excess of 60 years. There's no negative side effects whatsoever, other than possible soreness, muscle soreness.
But that's like a workout.
But it's a workout sore. And I want that and expect that. And the reason I want that and expect that is because it's also a trigger for the recuperation process.
Okay.
So no, there's no side effects at all.
And you also make the wave, it's called ARP Wave, because the wave is harmonious with the body, which you developed.
It is. It is. What we did is, if you look at how electrical stimulation is used in current medicine throughout the world, quite frankly, it makes no sense. And you explain that to the listeners out there in a very simplistic manner, and they look at you and say, well, you're right. That doesn't make any sense. So the simple way to explain it is if you ever had a leg cramp. Most people have had a leg cramp.
Oh, yes.
Did you want to keep it for 20 minutes? No. The first thing you did is what? You tried to get rid of the leg cramp by extending your leg out.
Yes.
Okay. So when you're having electrical stimulation done by any type of medical practitioner, the muscle is already in a cramp. It's already protecting you. Does it make any sense at all to contract it more?
No.
No. And then have you sit there for 20 minutes in a cramp? Does that make any sense? No. What does make sense is get rid of the cramp. That's what we do. We just get rid of the cramp.
Okay. It sounds easy.
It is easy, but very difficult to comprehend because no one's typically experienced it before. That's why it's very important for people to experience what we're talking about. And we offer them that opportunity.
Now, in doing this, do I have to go to a doctor to actually come to you, or how does that work?
Well, the first thing that we're going to have you do is fill out a medical questionnaire.
Okay.
If your doctor is reluctant to give you a prescription, because it is required to have a prescription, then we have literally a network of doctors who, based on the information that you've given us on the medical information, we send that out to the doctor, they review it, they know that it's impossible to get hurt by doing what we do. So they give you a carte blanche and they give you a prescription.
Okay.
And then we work underneath that auspices of that prescription. So we do nothing without a prescription.
Okay. And you need a prescription for this, but does insurance then cover it?
No.
Okay.
It's so far outside of the box, they don't even have a box.
Oh, I get it.
So it's classified as complementary alternative medicine, which in reality it's not, but that's how they classify it. I mean, we train doctors all over the world in traditional medicine, how to incorporate this into their practice.
Sure.
And, it's definitely not complementary alternative medicine, but that's how it's rated.
Okay. Now you're talking about it being outside the box. So how did this concept even come?
Well, again, common sense. I think common sense should rule our lives, but in some cases it doesn't. So if I were to say to you, if something was 99 9/10% unsuccessful, would you consider that a success?
No.
Would you look for something other than that to do?
Definitely, yes.
Okay. Well, the raw facts are that physical medicine is 99% unsuccessful at speeding up the recovery.
Okay.
So what we did is just try to find a way to get around that. How can we speed that process up? So we did it by simply turning everything upside down. If this way is 99% unsuccessful, well, if we turn it upside down, maybe this will work. And it did.
Okay. So the concept was part of you as a developer of the ARP Wave as well. And when you were studying under the actual gentleman,
Dr. Kotz?
You were studying under him and taking all the notes, then you're the one that actually came up with this being harmonious.
Yeah, I just came up with the idea that all of us know that we're an electrical body. I mean, most of the tests we do are electrical in nature, but the treatment isn't.
Yeah.
That makes no sense at all. So if you're an electrical being and the electricity in your body is controlled by your nervous system and it controls everything else, then why on earth would you ever want to work on a symptom that's the direct result of that system not working? Why not work on where it broke down?
Yes.
Rather than where it ended. So that's what we do. We find where it broke down, fix that, and then the symptoms go away. And patients out there, your listeners out there, one of the very first questions they say to us, how long will it last? Well, because they're so used to dealing with symptoms. Symptoms vanish, and then they come back, and then they vanish and come back. And you think, well, it's good for a while, and then it comes back. If you solve a problem, it doesn't come back.
Yeah.
So we solve the problem.
Okay. Sort of like fixing the spark plugs on a car.
Correct. Correct. Yeah, once they're gapped right, they fire the gasoline. If they're not gapped right, they don't fire the gasoline.
Yep. Sounds great. So we're talking about an offering that ARP Wave is going to promote, and we're going to work on that, and we're going to go ahead with that promotion that we talked about with some potential clients.
Well, I think it's very exciting because based on the success that we've had on your show, we all collaborated together and said, why don't we just have a show dedicated to showing the end result, the drama of someone living in pain, and then all of a sudden, what happens when they don't have to live in pain, how their life changes.
Sure.
So what we're going to do is we're going to create a television show where after the first of the year, right, coming up here, we'll have a show every week, I think is what we were talking about. And every week, we'll basically be evaluating the treatment process for a patient. And we're going to offer everyone out there in the viewing audience the opportunity to be on that show, send in a medical questionnaire. We'll have you give a website here later on where they can go into the website, they can fill out the medical questionnaire, it'll go to our medical evaluation board, and we'll select 5 people over the next 2 or 3 months into the new year, and we'll treat them at absolutely no cost.
Okay.
Provided they can come into the studio and provided they're willing to go through that process. And we'll change the quality of their life.
Okay.
Dramatically change it.
So we'll bring in Knowledge for Wellness, bring in the cameras, and we're going to capture them at home.
Correct.
And then we're also going to capture their treatments. Their first treatment, you said, was going to be very improved health.
Well, it'd be very revealing.
Yes.
So let's say that we have a patient out there or a listener out there that's been told that you're bone on bone in the knee and you need a brand new knee. And they can't move up and down the stairs without severe pain. They can't get out of a chair without severe pain. They've had to stop all the activities. They can't move without pain. We bring them in. We have them on camera. We go through the evaluation process. I can guarantee you within 5 minutes' time they'll be moving without pain. Now, when they see that, you cannot hide that emotion.
Right.
And others will see that and they'll say, well, wait a minute, if he can do that, I can do that. So the goal is to get the awareness out that there is an alternative to surgery. And surgery is the last thing in the world you ever want to think about when you're talking about a joint replacement. Because the reason you need to replace that joint is not a surgical problem. It is a strength problem. It is a muscle problem. It is a neurology problem. It is not a surgical problem.